Thank you for joining us tonight. We're here tonight with the Life and Breath Foundation to talk about the new Life and Breath Planner, and it's for sarcoidosis patients, and we're going to take you through the planner and everything that you can use it for. Real quick, my name is Nestorick, and I'm a volunteer and patient. I was diagnosed with pulmonary sarcoidosis in 2019, and I've been lucky to be part of the Life and Breath organization, volunteering for many of their events and patient coordination. Some of the things that Life and Breath does and why we exist is to offer the sarcoidosis community effective tools to track their journey, decipher medical issues, and maximize their quality of life. This being the planner that we're going to talk about today. The other thing that the Life and Breath Foundation does is we provide a nurturing environment for those affected by sarcoidosis and to share their experiences. The last thing is to build more awareness with the medical community to help combat this chronic disease. So this is just a little bit about the Life and Breath Foundation and why we exist. It was started 25 years ago by Sean Hull when his mother passed away, Ida Hull. We've done a lot for sarcoidosis patients, and we're just going to share with you some of the things that we do. So one of the things that we do is our monthly speaker series, our webinars. So we started these in 2020, and they're the second Thursday evening of the month, and you can sign up for them on our website. You can also get updates on them on our Facebook and Instagram pages, but there's so much information out there. So if you want information on an anti-inflammatory diet, supplements, what to do once you're diagnosed, anything like that, you can find all of that there in our webinars. They're all on our YouTube channel and on our website. The second thing is our monthly support group. This we just started, and we're having these once a month. You can get the dates for those on our website and sign up for those there. The next thing is the Life and Breath Scholar Program. This is really focused on physician education. We also provide support for sarcoidosis patients by connecting them with experts. We also have patient support through scholarships or sponsorships and education. And then we also have the My Life and Breath Planner. Again, that's what we'll be sharing today. So I'd like to introduce you to two people that are going to be joining us today. Dr. Elizabeth Carr. Dr. Carr, if you can just say hi.
Hi, everybody.
Dr. Carr is the program director for the internal medicine residency, as well as practicing pulmonary and clinical care physician at the Greater Baltimore Medical Center. So she's on our clinical advisory board. She's been critical in helping us develop this planner, and she's been working with sarcoidosis patients since 2001. Next, I'll introduce Abigail Mangum. She's our project coordinator at Life and Breath. Abigail, if you want to say hi.
Hello, welcome.
So Abigail joined Life and Breath in 2021, and she assists the team in patient outreach, administrative projects, and marketing efforts. So they're going to be joining in as I go through the planner and what it does and providing their perspective and how it helps. So quick disclaimer, this webinar will not give medical advice. So our speakers here do not know your medical background. So we will have a Q&A at the end. If you do have any questions, please make sure you put that in the Q&A. But please speak to your doctor before acting on any of the information that you hear this evening. So that's just our quick disclaimer there. So the Life and Breath, the Sarcoidosis Planner. So this is a planner that we developed in the last 2 years, really with the goal in mind to help patients. We interviewed several patients to get their feedback on what would be helpful for them in their journey as they go through, trying to figure out how to communicate with their doctors and how to, have a healthier life. So this is the Life and Breath Planner. I'm going to just share with you a couple screenshots as we go along of, some of the pages in our planner that you can get. This planner comes in a printed and in a digital format, and we'll share with you at the end how you can request one. We've sent tons out to patients already. We've gotten lots of positive feedback. So what this is it's a tool that's going to help you track your medical records and appointments, track your symptoms, track your habits, track your medications, and a lot more. So we'll take you through all of that and how it can help. So using your planner. The planner has 5 different sections in it, all with, specific areas that will help you in your sarcoidosis journey. The first one is to help you communicate with your doctor, communicate with your family members and caregivers, create goals, and to look for correlations as you track your habits to understand, if you change things in your lifestyle, will you see, improvement? So Dr. Carr, maybe you can jump in now and just tell us a little bit why it's important to share some of this information with your doctor.
Sure, I'm happy. Thanks, Ellen, for having me on, and welcome everybody to the journey with your planner here. We called it my journey, basically, because it really is about your journey with sarcoid. There, as a doctor, it is really, really, really helpful when a patient actually has a well thought out and well described interpretation of their disease. And so that's probably how we can help you best, is really if you come with all this information in one place, not only does it keep you centered, it also really will help your doctor kind of navigate all the complexities, because there's so many things that we have to think about all the time. Not only do we have to think about your symptoms, we want to think about treatment plans that you've already had, some that have been successful, some that haven't, why they haven't been successful, and all of that can be kept in this place. And then in terms of your symptoms, what treatment actually helped which symptom, that's also really, really helpful for us. And then also just sort of you being able to keep track of the testing that you've had done in one place. And then that's also something that if you have doctors that are all over, we're lucky here in Baltimore. We've got great access to everything through the electronic medical record, but some places just don't have that. So if you have stuff that's come from all over, you've got x-rays that are done here, CT scans that are done here, blood work that's done here, an EKG that was done somewhere. It's really great to be able to have all of that in one place, so your doctor can actually make that appointment that you have with them very, very focused. And I think it makes it much more satisfying for the patient, as well as getting better care from your doctor. So I think I'll stop there and let you continue on with the pages, and we can keep answering as we go.
This sounds great. And, as a patient, all I can say is that when I was diagnosed with sarcoidosis, I found everything so overwhelming. And, having something like this to help me, track everything and stay organized really helped a lot. So as I said, there's 5 sections to the planner. We're going to go through just an overview of every section that you're seeing on here. So the first section is initial sarcoidosis diagnosis. So this section is really meant for the early stages of your diagnosis. So when you're, meeting initially with doctors, you're tracking what your initial symptoms are, tracking the tests that you're getting for your initial diagnosis. So your CAT scans, blood panel, tracking your initial symptoms and severity. So these are examples of some of the pages that you'll find in the planner. One is to track your initial tests. The other one is tracking your symptoms and your medications that you're having. Again, these are for your initial diagnosis. So Dr. Carr, again, why would it be important to track, the different tests that you have as you're getting diagnosed in the early stages?
That's a good question. I think the key thing here is this can serve a little bit as a hey, do I need this particular test or not? Generally speaking, in the early phases, we really do want to check all of these things. So it gives you, again, a place to be able to put that information in there. The results section is going to be really complicated, because if you've ever seen the results of a CT scan that have been printed out and handed and you've mailed to you or something, excuse me, sorry, you're never really going to be able to fit all of that in that particular little box here, but that's okay, because really what we want is sort of an overall summary. And then again, it's really helpful to sort of be able to take perspective. If you've got everything on your initial test page, then when you later on, you'll talk about some other pages that we have later on testing, you can use as comparison, and your doctor can too. So again, from a doctor's standpoint, the more the information is actually in one place for us to be able to quickly skim through, the better. So I think, again, it empowers you to be able to have a better conversation with your doctor.
Sounds great.
Yeah, so this section, that section 1 was basically designed to be, hey, this is where I started from. So then all the other ones will kind of build off of that.
Yeah. Thank you, Abigail. So this next section is my sarcoidosis journey. So basically you've been diagnosed with sarcoidosis. Now this is tracking your journey. This might be more long-term. You're going to track your medications that you have for sarcoidosis, track your sarcoidosis symptoms, track your follow-up visits, blood tests, test results, doctor's visits, notes, appointments, planning sheets, and summary for your doctor. So, I've been there where I've been in doctor's appointments and I can't remember what questions I wanted to ask. And then I leave and I can't remember what was said. So this is an area for you to really document all of that and then just have everything in one place. It's also great if you have a caregiver or family member that's helping you that they can refer to as well. So this is where you'd keep track of some of the treatments that you'd have for sarcoid and for some of the medications that you might have. So Dr. Carr, maybe you can give us some examples of some of the treatments that, patients might list on here.
Yeah, and I think these 2 pages right here for me in particular, when I'm treating my patients is so important. And I wish that we had this on our end as well, so that we could actually keep everything in one place like this. So really here, the idea is, okay, look, you started on prednisone, you started at 20 milligrams, sort of a standard dose that we would start a patient at. And then it talks about, dosage, when did you start it? If for some reason you had to stop it, and why, right? So maybe you were intolerant to it because it made your sugars out of control so that you ended up needing to switch to a different medication, or, lots of different side effects that you can get from your medications. Maybe that's why you stopped it. Or maybe it got stopped because you ended up transitioning to a different medication. And then that would be where you start putting with dosage adjustments. So if you are on the prednisone 20 and you've been doing really well for 3 months, and now actually we want to start coming down on the dosage, you could actually start writing that down in your dose adjustments and how your symptoms are as you adjust the dose. Other medications, for example, methotrexate would be another one where that would be really important also to know, like, what treatment you've tried, how did it work, what were the side effects. Did you need to go down on the dose because of a side effect or because of improvement in your symptoms? Do we not need, did you have side effects that were significant and we don't want to go back to that medication later, 4 years down the road? We want to know that, like, oh, you know what, that was not a good medication to try, or we tried it, it didn't work at all. So these 2 pages are actually really important. And this is really where you're going to keep your sarcoid meds, not necessarily all your other medications that you might be taking. For example, if you have high blood pressure, you're not going to want to keep it on this medication, on this particular page, unless you do want to do that, in which case you may want to print out a second page and you might want to write at the top instead, cross out treatments for sarcoid and maybe put in other medications that I'm using. So you have a lot of flexibility with this, with the planner, in terms of being able to keep track of that.
Thank you. And Abigail, she'll share with us at the end how to get the planner. But if you do request a physical planner that you'd get in the mail, you can also get a PDF of it as well. So like Dr. Carr said, you can print out those extra pages, you can make it your own. The next example pages that we have for this section are your potential yearly follow-up tests, your blood test results, things like that you'll also find in this section. So, Dr. Carr, we can see some of the tests on here. So, is this recommending that all patients get these tests, or how should they use this page?
Okay, that's another great question, actually. So this is going to depend a little bit on the type of sarcoid that you have. In general, most patients, most times, we're going to be getting a CAT scan annually, a CAT scan of your chest. We're going to be getting yearly blood work. We're going to be getting an EKG. The thing is that sometimes you might need other things to be tested as well. And so, there's lots of different blood tests that people can follow. So for example, if you have your standard would be that we want to look at your liver test, that's fine. But let's say you've actually got kidney disease involved, your sarcoid's involved in your kidneys are involved with sarcoid, then what you want to do is make sure that you've got urine tests that are specific that we want to be able to look at. So there's lots of different things, but this standard page right here are basically what we would want to get on a regular basis every year for the most part. But we want to give you the option to be able to have other tests, for example. So even though there's only one line there that says other, there's space at the bottom of this page so you could actually write in other things, other tests that you might have had. For example, you might be having an MRI of your heart, right? So that is a test that is not on our page here, but certainly something that you could be getting. It's not typically ordered every year. Sometimes usually what we would do with those kinds of tests, ones that are a little bit off of what I would call the beaten path, is that we would you might then have an MRI now and then again in 6 months after treatment has been completed or thinking about stopping treatment. So those two things you might want to add at the bottom of this page as well. In terms of blood tests, this is going to be, you're not going to be able to write every single test result down because, a CBC comes, I don't know if you guys have seen that recently, but it comes with probably 14 different things, of which we only really care about probably 3 to 5. So it might be worthwhile, at your first appointment with your doctor to say, like, what part of this should I be tracking? That's another thing, and then that way you can know what to follow. Sorry, Abigail, did you have a question?
Oh, no. Yes. So there is a section in this section, there are several pages where we have put together a section of like, hey, if you have heart involvement, then these are typical tests that might be ordered, and a section for you to put the results, and then a quick description of what that test is, because I'm sure, as you guys know, there's a lot of jargon in medical terms. So we had the doctors just go through and be like, oh, this is what this actually means, and what is an EKG, and just like a description of them, as well as a place to put the results. So there's sections for heart, for lungs, for skin, and then there are quite a few more, and then there's a whole blank section. So there are a lot more charts that you can track depending on your sarcoidosis involvement.
Yeah, I think that's actually I think having organ specific pages is one of the things that we spend a lot of time trying to figure out as well, to best help our patients kind of know a little bit about what we think should be sort of standard of care and what we think is likely that they're going to need or want. And obviously, after having a conversation with your doctor, you decide about how frequently they want to follow those things. So I'm really, hopefully Abigail will see a picture of one of those pages soon.
Yep. Thank you. And if you can see at the bottom there, we have in some of the areas links to where you can find additional information. So, I mentioned our webinars in the beginning. Dr. Carr did a great webinar on tests needed after sarcoidosis diagnosis. So you can go to that. You can find on our YouTube channel or on our website. But again, you'll find more information there. Again, we'll be doing a Q&A at the end specific to the planner. But, if you have questions on tests, things like that, please refer to the webinars that we have. So this is one of my favorite ones, the appointment planning sheet, because like I said in the beginning, as a patient, I would go in the beginning and I wouldn't know what questions to ask, or if I did have questions, I'd forget them once I was there because I got overwhelmed or I was anxious. And then, my doctor would, tell me things that I needed to do to follow up. And, I didn't always have something to write that down, or if I did, I didn't have a place to put it afterwards. So these I find helpful as a patient because I can print them out or take them out of my binder, write on them, and then put them back in. So when I go to my next appointment, I can go look at them and check on them. So Dr. Carr, especially, the summary page that you would give to your doctor, what are your thoughts on that? How would you work with a patient with these?
Yeah, I think this is so important because I think to be your best advocate as a patient, being able to actually ask the questions that you need to ask to remember them is great, because we do all forget. There's no two ways about it. That, oh, you're walking out the door and you're like, oh shoot, I wanted to ask something. So this is a great place to do that. And also, it really keeps everything organized, right? So you're not kind of going off on tangents. You can keep your appointment focused, because I know a lot of doctors don't have a whole lot of time. So if you have a half an hour appointment with your doctor, you really do want to keep it very focused so that you can get the help that you need. The things that you want to remember is great. And one of the, we, for example, when we use Epic, which is the electronic medical record that we have at my hospital, GBMC in Baltimore, we can print out what's called an after visit summary. So a lot of different electronic medical records will have some sort of paper that you can go home with some instructions, things like that. The problem is that it's not centralized in one place. So this allows you to have that centralized in that one place. And Ellen, like you said, when you want to go back and refer to it, it's very easy for you to find it, right? So I think that's the other thing, because as we all put pieces of paper, yellow sticky notes or whatever, they end up all over the place. And so really being able to have something organized and in one place, I think is so helpful for you guys.
So I'm going to go on to section 3. So this is tracking your habits, your symptoms, and your medications. This is my absolute favorite section of the whole planner as a patient. And it really helped me when I was first diagnosed, just because it's an area for you to track your meals, exercise, water, sleep, track any additional medications, symptoms. It really helped me form better habits. When I was first diagnosed, the person that actually told me that I had sarcoidosis, unfortunately, I said, is there anything I can do? And they said, no, there's nothing you can do. And I lost hope. But when I got into habit tracking like this and watch my diet, I thought, there's got to be a better way. So at least if I could start eating better and tracking it, sleeping better, and seeing if there's a correlation with my symptoms and what I was doing. And I did see improvement. So that just really gave me hope. And I think if I wasn't tracking, I wouldn't have noticed the improvement as much as I did. But I really started to see, as the days went by, how things were improving. I also noticed that when I had a good day, it was typically when I took care of myself more. So that's just from my personal experience. So these are the pages that we have to kind of track your daily habits. So tracking what food you're eating. Again, in terms of food, we have plenty of webinars out there on an anti-inflammatory diet and what you should eat and as a sarcoidosis patient. Breakfast, lunch, dinner, snacks, water. You'll see on here cardio, strength training, flexibility. Also tracking your stress levels. How you're feeling, how's your mood, how's your pain, sleep, how many hours are you getting? So for me, and this is just me personally as one patient, but I could see, my stress levels and my mood, everything got better the more I took care of myself, like I was saying. So this is just a great area to really keep track of that, as well as your symptoms and other symptoms that you might not always think of. We think of the most common symptoms, but this also includes, things like just fatigue or insomnia, things like that. So Dr. Carr, do you have anything to add on the habit tracking and how a patient might find this useful?
So first of all, I love this because it's color coded. And for me, I'm a very visual person. So it really is a great way to be able to kind of quickly check in with yourself. I do think as we're sitting here talking and I'm listening to this, the tracker is definitely something that we work on and we're continuing to work on and make better. I do think that having some place where we can have a visual where there's correlation between your stress and your symptoms would be really great, right? So we may have to come up with another page that we throw in here that has some color coordination that makes it all kind of like, oh, my stress level's really high, my symptoms are really bad, right? So that there's a correlation there that you can actually see. Because I think that finding a needle in a haystack, that correlation thing, can be really hard unless you actually have a place where you're documenting it all. So I do think, again, that it's super helpful to be able to kind of think about these things that way. I mean, I've had so many patients, we know that sarcoid is related to stress, right? We know that stress can exacerbate it. We know that it can cause flares. But the things that we haven't totally figured out yet is like the food correlation, because I have one patient who swears that gluten, actually, as soon as she eats anything with gluten, she gets these horrible coughing spells that are all, I mean, that just won't go away, and a flare of her sarcoid. It's really interesting. So for her, using something like this is how she actually figured that out. So I do think that keeping track of this kind of stuff is great, and figuring out, what works for you, and what kind of exercise or sleep you're getting and things like that is really terrific. So yeah.
And I will say we have multiple pages of this. Abigail, how many pages of this do we have so that you can use it daily in the printed version?
I think the printed version comes with 10 days,
Yeah.
but then you
And-
can download a PDF that has all 31 days, like a whole month summary.
The entire planner is about 60 pages. Again, if you have the binder, you can print out additional pages. If you get the digital version or the PDF version and you want to print it on your own, then you can just print the sections that you will find helpful. So really, this is, even though we have it set up in a certain format, please, we want everyone to make it their own. So these are additional pages that we have in the habit tracking section. So it's kind of tracking your symptoms and the severity, but then also a monthly calendar. And we left the monthly calendar blank so you could kind of use it how you wish. So this is, one of the things that I would do is like look back after a couple weeks and try to find out, am I seeing improvement? When did I start to feel better? And, really try to look for, what made things better or worse.
Can I jump in here? Oh, can we go back one slide?
Yeah.
So this is the stuff you're going to want to bring to your doctor's office. You're not going to want to bring 31 days or 90 days worth of individual sheets. The individual sheets, the daily summaries that we were looking at before, are really going to be where you're looking for clues for yourself. What you're going to do on this is the month summary is a much more helpful tool to bring to your doctor. And so I highly recommend really kind of using the first pages as kind of all the data points, and then figuring out how to get that information into this so that you really have a better kind of overall progress that you're, because if you bring 90 pages to your doctor, they're going to probably cry. So you're not going to have a half-hour appointment. You're not going to get through the doctor's appointment the way you want to get through. So
yeah, and like how I would use it is, if I was having, headaches, I would track what days I was having headaches in my monthly calendar, and then I could look back and see, okay, am I seeing a correlation? Are there days, that I'm not getting enough sleep or not drinking enough water, things like that. But again, share these sections. Do not, you don't want to take your whole binder into your doctor. Unfortunately, they don't have, the time that allows to go through all of that. So I'm going to go through the next section. So again, there's 5 sections. So we're almost through. We're at section 4. This is the section for my records. This is where you want to keep track of all your healthcare providers, insurance information. When you go to your first doctor's appointment and they ask you to fill out all of those forms of all of your surgeries, all your allergies, hospitalizations, things like that. This is where you can put all of that information so that when a new doctor needs it, you can find it easily. It's also, again, great to give to your caregivers, or family members that might be helping you, so that they have all of that information as well. You can also keep your legal documents in here as well. So section 4, there's a couple pages in there where you could just fill out with all of your legal documents, but you can also, this binder is yours, like I keep saying. So print out materials, anything, and you can just add it to the section too. The last section is section 5. This is another section. It's really just in there, just for you to put test results, printed documents. I know when I was first diagnosed, I had a folder, that had all of my test results, things in it, all printed out. So, instead of trying to fill out every little form in here too, you can really put some of those results in the back, so it's easier to find. So that's pretty much our planner. Abigail, Dr. Carr, anything to add?
I don't think so. I was gonna maybe try to just share the Canva and kind of give them a full, hey, these are all 64 pages, quick overview.
Sounds good. Well, I'll show real quick. I'm going to go through our quick disclaimer. So again, this planner is not to be used as medical advice. Please look through the whole disclaimer that we have in there. And then also, this is how to request it. So Abigail, helps us with coordinating all of this. So if you're at request one, you might get a message from Abigail. You go to lifeandbreath.org/sarcoidosis-planner. You can get the digital planner, a PDF, and the printed planner. Also, one thing I want to mention that you can pay it forward. This is being offered to patients without a cost. It does cost us about $25 to print and ship them. So if you would like to, you can make a donation on lifeandbreath.org and help pay it forward for another patient. So I'm going to stop sharing and let Abigail take over so she can share.
All right. So this is in our design account. And this is just going to give you a quick overview of like literally all of the pages. So we have, this is our introduction section. We have your initial sarcoidosis. This is version 2, so it is color coded. That was some feedback we got. So each section will have its own color code. Here are these pages I was talking about, where you're going to get, okay, here's your lungs. If you have lung involvement, these are possibly some tests and descriptions that your doctor might order. And then we have eyes, skin, all the different ones. Here's your doctor summaries, charts that we talked about. And then here is your section with all of your month records. And then basically documents is in the back. So when you go to this page, this is our planner request page on the site. You have a little, we'll end up putting this video here as well. I've done a little video showing you how to use the digital version. It is pretty clunky, but we're working on that. And then you can request whichever planner you're looking for. These both will come in email form. If you do request a printed one, we ship it out at the beginning of the next month. So we just do one big shipment each time. So it would take a little bit of time to get to you. And then this is what I was talking about. We have a feedback form where you can give ideas of things that you liked, ideas of things that you would want added. And we really do listen and have changed and updated a lot of things. And then this is our other page, the planner additional material. So this is going to be, you'll be able to download a whole month of your habit tracking sheets. This is your extra doctors, patients, health summaries, and appointments, and printables, all the little extras. And it's just set up to make it easier for you, so you don't have to go through and sort out your PDF of, hey, what do I actually need here? So we're working on keeping improving. Please send feedback, but that's where we are right now.
So if you have any questions at all, please ask them in the Q&A, and we'll try to answer them. I'll start to go through them. In using the planner, should you document only sarcoidosis-related symptoms, flares, or document everything to bring to your doctor?
It sounds like that's a me question, huh? So, I think that's really interesting. I think the first thing is that we have to sort out what is actually sarcoid versus what is something else. And when you're on your journey in the beginning, it may be that everything is sarcoid. So it's probably worth kind of keeping, certainly in the beginning, you're going to want to have all of your symptoms documented so that we can actually go through and figure out which ones are sarcoid versus which ones are something else. The ones, for example, that are the most complicated would be arthritis. Okay, there are lots of people who have arthritis that may actually be arthritis because of osteoarthritis, right? As opposed to from sarcoid. But, you know, nobody expects patients to be able to sort that out in the beginning. So I think you track everything. Once you get really more comfortable with your disease, then you can start tracking more specific. So, I mean, I think in the beginning, you kind of track it all.
The next question we have is, a tractor something a doctor is interested in? So Dr. Carr, I'll let you answer that one again.
Well, I've spent a lot of time and energy trying to make this tracker, so I think yes. You know, I think that you're going to find a doctor or two who might not, but I think in general, yes. I think, you know what, I think in the year 2023, medicine is now practiced in a way that it is actually a patient-centric way that we like to approach medicine. We want our patients to be advocates for themselves and involved in their care and involved in the decision-making process, so that we can actually really help you achieve all the goals that you want to achieve. And I think one of the hardest things is really having this particular disease organized. And so I think the planner does help with that. And I think I really do think if the planner is used well, you know, and you kind of get used to it and all that other stuff, that it will actually really help you and your doctor have a better appointment together, right? Because you're bringing the information that the doctor needs, and you're going to walk out with more help than you walked in with. There's going to be times where it might be overwhelming to a doctor because maybe they're not very familiar with sarcoid in the first place. And part of what we thought about when we were building this planner is, how can we also help some doctors who may not be that familiar with sarcoid to kind of know what sort of is expected or would be standard of care. And so I think it's okay to advocate for yourself and to maybe share that with that doctor, so that you can get, both of you can get what needs to be done for you.
I'd say too, when talking with your doctor too, it'd probably be helpful to bring a copy, a photocopy, so that you can leave some with them. So if they want to, you know, so that way you can take yours, put yours back in the binder, but then also if they want to have them to look at afterwards or to put on your file, maybe.
You know, I think actually, if I can just jump in also, there
Yeah.
is, again, in Epic, the reason I talk about Epic, I have no investment in Epic or whatever, no financial disclosures for Epic, but it's what I use. It has about 1/3 of the market share around the United States and probably around the world in terms of electronic medical record. So that's why I think it's okay for me to bring it up here. I'm sure others have the same functionality, but there is a My Chart for those of you who know Epic. My Chart actually has the ability for the patient to scan documents into their chart, right? So for example, you and your doctor are, you know, you could be living in Idaho somewhere and actually have a physician who has Epic, and you can, from your home, your doctor might say, look, you might be seeing a specialist who's, you know, in Salt Lake City, for example. You can then say, look, I'm going to track my symptoms, I'll upload them to you. And you can use the planner, and you can upload, you could even upload like the monthly sheet instead. And, you know, so it's an effective way of being able to communicate that back to your doctor too. So I think that physicians who treat sarcoid are definitely going to like this.
And we have made a trifold that you can share with your doctor. It overviews sarcoidosis, but it also has some information about the planner and about Life and Breath. So if you are interested in getting a trifold to share with your doctor, then you can email me and I'll put my email.
Sounds great. Any other questions? Abigail, did we get any questions ahead of time? Do you want to?
Yes, we got a question about how to access more information about the best diet. So I want to share with you our YouTube channel. We do have a page about our YouTube channel right here that's going to have QR codes, but we also have a just amazing YouTube channel with all sorts of playlists, talking about different things, staying healthy. And then we have all of our speaker series. Whoop. We have all of our speaker series that we've done for the last 3 years on here that you can search by topic. So that's a really great place to learn a lot about the behind the scenes of why did we put these sections in the planner.
I will say we do them once a month. I think we do 11 a year, but we do a Q&A at the end of each of them. So if you can, get on the webinars when they're live, because you'll be able to ask the expert questions. And as a sarcoidosis patient, it's hard to get information, and to 11 times of the year to be able to ask directly an expert questions from all over the country is extremely helpful. So we have speakers there on every topic you can probably imagine for sarcoidosis. So, and we keep adding to it. So again, also too, if you have any suggestions for webinars, please feel free to message us, and we'll try and get them in. We are very, very open to getting feedback from patients. That's why we developed it. That's after research and talking to patients. That's why we developed the planner. So anything else?
We had one patient ask specifically about how would they track attention problems. And I didn't know, Dr. Carr, based off of the habit sheet, if there would be, whether they need to add something or what you would say to that.
I think attention would fall under neurologic, right? So I know we have a page under neurologic. That would be where I would put that. I think the concept is that on the color-coded sheets that I love so much, they are, and I think Ellen loves them just as much.
Yes.
They're not very symptom specific, right? They are more like, how do I feel overall? What symptoms am I having? So attention would just be a symptom that you would write on that second page. It says symptoms. Yeah, I think you're gonna have to probably pull that up so people can see, but I think that's where I would recommend putting it. But under as a sort of an overall, where does it fall? I would probably put it under neurologic. It could either go under neurologic or actually psychiatric. So psychiatric would be mental health. Attention can actually fall under mental health, along with depression, anxiety, and things like that. So yep, that's the page where you would put your symptom description or your symptom. Yeah. And again, on the bottom part, other symptoms, there's blank lines for you to fill in, because obviously we may not capture everything.
Sounds great. Well, thank you, Dr. Carr. Thank you, Abigail, for joining us. Thank you for everyone that joined us live tonight. We'll have the recording out on our website. Abigail, did you want to add something?
We just got a few more questions.
Oh, okay. Well, hang tight.
I tell you, that's what happens.
Would you use the tracker as a tool to make sure your annual testing is recorded and done regularly?
Oh my gosh, yes, absolutely. That's the other thing, right? So most women will eventually get their mammogram in their birthday month. It's not necessarily a great birthday present, but it is a way to remember when to do it. And so I think that's sort of the same point here, is like, wow, how do you remember when to get stuff done? I have some patients who have a CT scan done in October, and they have their breathing test done in May, and then they have lab work done in January. So how do you kind of keep track of when you're supposed to do it? And as a physician, I do not have a mechanism. There's nothing built into my fabulous Epic that I keep talking about. There's nothing that actually helps me say, oh, look, it's Ellen's time to get her blood work. I better notify her. So again, this is where you can advocate for yourself and keep track of it. I will say, I do try to get everybody into the same month, so that it's like, okay, the month of whatever, April being Sarcoid Awareness Month or something, would be the time when you might want to get all your testing done. But yes, use the tracker for that. Absolutely.
And
Great
I'll
idea.
say, when I was first diagnosed, I was surprised that although I was diagnosed with pulmonary sarcoidosis, I was told I need to get my eyes checked yearly. I need to go to the dermatologist yearly. I need to get an EKG yearly. So these are things that tests that things that I might not have done before that I now had to add to my list. So as a patient, you're typically thinking, where the organ's involved, but there's other tests that your doctor might suggest that you have. Is there a problem with printing the sheets at Office Max concerning copyright? Use it how you wish, please don't print it and, sell copies of it. This is a resource we want to give everyone. But, there shouldn't be an issue of where you get it printed. It is big. So you probably are better off getting it printed at, somewhere like Staples or Office Max or somewhere, it's about 60 pages. So I know for most of us that have printers at home, you'd run out of ink pretty quickly. And again, you can also request the full printed binder as well. As a doctor, what would you want to see presented during the visit from your patients as a handy guide?
So I think if you had to bring one page, I don't know. I think actually, I'd say probably like at least 4 pages that I can think of. You're going to want to bring your summary of symptoms. Now, if you don't have any symptoms and you're just coming in for regular follow-up, you don't need to do that. But imagining that you do have it, you're going to, my sarcoid summary, right? Isn't that yep. I think this is a good one to bring in. If you don't fill it out, that's okay. But if you are able to fill that out in a way that's even meaningful for you, that you fully understand, then that's good. What as a doctor, what I'm looking for is I'm looking for response to treatment or the need to start treatment, right? So, I'd like to not start patients on treatment if they don't need it. But if we're starting to notice that symptoms are escalating as you're going along without treatment, then maybe we need to do it. So my sarcoid summary, I think, is also a pretty reasonable 1 page. The other page that I think is really important to bring in would be the medication page if you are actually on treatment. And if just to have with you every time, just in case there's a conversation about needing to start new treatment or something that you may not have anticipated at the meeting. So bringing that would be important every time. And then I think any tests that you might have done that might have been from a different physician or over the course of the past X months since we've seen each other, that might be helpful to bring too. So I think you could probably put it into a small folder. You can honestly bring the whole folder. That's okay. Like you can bring it. I mean, I have patients who will bring a lot of stuff as long as you know where to find the answers to the questions if your doctor has questions, right? So there's no reason why you can't bring the whole thing with you. It's not going to be heavy, and so it is meant to actually be portable for you, and so that you can have all that stuff and you don't have to worry about which one. Oh, I forgot that page. So that's fine.
Sounds great. And I'm seeing a couple questions in the chat and the Q&A about what tests I should get, things like that. Just a reminder that Dr. Carr does have a webinar out there on what tests that you should get for sarcoidosis. There's also a lot of other webinars just on, when you're diagnosed, things that you should know, what you should get tested. You really need to ask your doctor. This sarcoidosis, we call it the snowflake disease because every patient's different. So, please, ask your specialist. Another question is, can this binder be used to help with disability filing as support?
So in all honesty, I think you're going to need your doctor's note to be the one that actually is going to be submitted. So it's not necessarily going to be documentation that would help you. Again, I think that's going to depend on your probably your human resources department or benefits that you're particularly working with or something like that. But in terms of being able to file for disability, it will be through your physician. Now, there's a lot of paperwork that goes into that, right? And that paperwork can be pages and pages of, symptoms. When did I do this? When did I do that? Or, you know, what was the last patient, when was the last time the patient needed to be hospitalized? When was the last time the patient needed to miss work? When was, you know, things like that, that I may not be able to answer effectively. So of course, if I do have the information in one place, that'd be great. There's no version of our binder that is going to have that one page that is going to be able to fill that out. So I think that I don't know how the binder would really actually end up helping in that situation, other than, again, making sure that your physician is able to document all of the symptoms that you have and what kind of, you know, what trajectory your disease is on.
Thank you, Dr. Carr. Well, thank you. We're gonna close out this session. Again, thank you everyone for joining us tonight. We appreciate you coming on, and we'll put this out there on our website and on our YouTube channel. So thank you, Dr. Carr. Thank you, Abigail, for joining us, and everyone have a great night.
Thanks, guys. It was great to see you. Thanks for having us. Bye.
Good night.
Good night.